bring in Dr. Lesley Bamford from the Health Department. We just heard the comment from the Western Cape Provincial Health Department saying they'll continue to monitor the situation regarding this new subvariant of Omicron, which has been dubbed XBB.1.5, but also known as the Kraken variant because it spreads so fast. It's highly transmissible. Dr. Bamford, good afternoon. We just played a bite from my colleague Sindelo Masigana. They're speaking to an official of the Western Cape Health Department earlier, saying they are monitoring the situation. We understand that the department has been in consultation with scientists. They've told us that, and that we should be expecting some statement from your side as a health department about the way forward. But this afternoon, what are you able to share with our viewers here on eNCA? Good afternoon.
So good afternoon, and good afternoon to the viewers. So I think we can share a number of things. First of all, it is true that we are awaiting the details of the first case of the new subvariant that has been identified, and we will issue a full statement once we have all of those details. Second of all, I think we have consistently shared the message that whilst we currently infection rates in South Africa do remain low, that we continue to be concerned about COVID. We do not consider ourselves to be out of the woods yet. We continue to see people who do become ill with COVID. We see people in our hospitals and some deaths on an ongoing basis from COVID. So people need to remain vigilant and continue to protect themselves, primarily through vaccination, but also through taking other precautions, such as wearing masks if they feel comfortable doing that, avoiding very large gatherings, particularly if they are vulnerable to become infected and to suffer from severe COVID. In terms of the new subvariant, as well as the evolving situation in China, we are monitoring that very carefully. We will be increasing surveillance in the coming weeks. But the overwhelming message remains the same, that people should continue to protect themselves, and the best way to do that is to come forward and be vaccinated.
Should we be concerned, or maybe perhaps the question is, should you not be concerned when you hear reports that COVID hospitalizations in the US have spiked 16.1%, according to some latest reports in the past week, as this new variant, they're referring to it, the escaped variant. I don't know why the Americans are calling it that, as a new variant is affecting the country, sweeping across America, and is today the single largest contributor to the hospitalizations, which have gone up in the US.
So, as indicated, we need to monitor the situation very carefully. This variant remains a form or a subvariant of the Omicron variant. And in South Africa, we believe that we have high levels of population immunity against the Omicron variant, and that it is likely that this will continue to protect South Africans. However, as I've indicated, we do need to, and we will monitor the situation very carefully so that we are able to detect early if there is an increase in the number of infections, and particularly if there is an increase in the number of people requiring hospitalization.
You said people must remain vigilant, therefore there's no need to panic. But by when would you be able to make a decision whether or not some level of restrictions should be brought back?
So we will have to monitor the situation. We do not anticipate that we will see a surge in the number of cases, and we do not anticipate that we will need to reintroduce any restrictions. However, the pandemic has taught us that we cannot always predict what will happen. So we do need to monitor very carefully. We have had, as of yet, only detected one case of the subvariant. That needs to be monitored very carefully. But more importantly, we need to monitor any increase in severe infections. Our hospitals are now well prepared to deal with an increase in the number of people requiring admission, but we will monitor the situation and see if any restrictions do need to be introduced. Although, let me just repeat that we do not, at this stage, anticipate that that will be needed.
Okay, your monitoring, would it include also checking inbound flights? You mentioned China earlier in answering one of my questions, and I related to you what the reports are coming out of the US are saying about this subvariant. When you say monitor, would you also be encouraging the port authorities to monitor inbound traffic, especially from China and the US?
So our scientists have advised us that currently they do not think that from a public health perspective it is necessary to be reimposing any travel restrictions. As indicated, we will be increasing surveillance. That includes increasing genomic surveillance across the board, but also with a focus on we would look to the genomic surveillance to identify importation of any of these cases. However, experience has also taught us that travel restrictions at best delay the emergence or the certain variants becoming dominant. So again, we do not anticipate that South Africa will be imposing any travel restrictions.
Okay, when can we expect that comprehensive statement you mentioned earlier from your department this week?
It will certainly be during the course of the week, yes.
Okay, not an exact date. Okay, in the meantime, the simple message is be vigilant, don't panic.
And vaccinate, yes.
And vaccinate. Thank you very much. Those three things I think are easy to remember. Dr. Lesley Bamford from the Department of Health. Be vigilant, don't panic, and vaccinate. She's speaking, of course, about the discovery of the new XBB.1.5, or also now colloquially known as the Kraken virus, which is a highly transmissible subvariant of Omicron. It has been detected, at least by gene sequencing at Stellenbosch University. But for now, there's ongoing engagement between our scientists and the Department of Health. We'll have to wait and see later this week what kind of statement will come out from Dr. Joe Phaahla, the Minister of Health.